We begin tonight with the coronavirus and fears it could rapidly spread around the world. Several cities in China appear abandoned with quarantines in place affecting millions of people. New cases have been confirmed in several other countries, Canada, Australia, and France.
Health experts think the virus first infected humans in Wuhan, China. A U.S. charter plane carrying Americans departed Wuhan a few hours ago. It's now on its way to Anchorage, where travelers will be re-screened for the virus. So the Trump administration reports U.S. health officials are already at work on a coronavirus vaccine. They hope to start clinical trials within 3 months. Good evening. I'm Mark Wright.
I'm Joyce Taylor. A Snohomish County man continues to recover from coronavirus. His was the first case reported here in the United States. 3 University of Washington students are now being tested for possible infection. There are 110 possible cases in the United States in 26 states, including here in Washington. In China, 106 people have died. More than 4,500 cases have been reported there. The U.S. has offered to send a team from the CDC to China to help with the public health response. And the company 3M says it's ramping up production of those filter masks to meet demands there. And CNBC is reporting Starbucks has closed all cafes and halted deliveries for locations in China's Hubei province.
We're also learning that Sea-Tac Airport will now screen passengers traveling into the U.S. The government increasing screenings from 5 to 20 airports now. King 5's Glenn Farley joins us live from Sea-Tac Airport.
So, Glenn, the global concern is really front and center right here in the Northwest, isn't it?
Well, yeah, we were the first case, but this has become, obviously, as you point out, a much bigger problem. So late this afternoon, Sea-Tac Airport did get the official confirmation that they would be one of 20 new screening locations keeping their eye out for this disease. But I want to push up here and show you something. Through that window is the new international arrivals facility here at the airport, still under construction. We'll take you in there for a second. In a second, but we have seen this movie before, and as you'll see, remember the bird flu? As the volume of passengers going through airport expands, so does the need to screen for disease. The year is 2005, and Sea-Tac is bracing for a serious bug. International travel here is picking up, and the U.S. Public Health Service maintains a quarantine station in the lower level of the South Satellite. But on any day, public health doctors and other professionals in uniform keep their eye out for the sick. And historically, the U.S. has long screened for ill people. Because of drugs, quarantine in terms of isolating folks for periods of time is used far less often.
Visitors, visa and ESTA 4, 5, and 6. Welcome to Seattle. Good afternoon.
Since then, Sea-Tac has become an international arrivals hotspot in a facility that's been stretched beyond its limits for years. Now the airport is playing catch-up. A new bridge was connected this weekend to carry larger volumes of people into a new international arrivals facility or hall, and now we're in it. So I've crossed the bridge, kind of worked our way down. Where do I enter here?
So you'll come down the escalators at the south end of the facility. You will come down in this area and you'll pick your luggage up from one of our 7 bag claim devices.
Janet Shearer is the construction manager for big projects at Sea-Tac, and the International Arrivals Hall is one of the biggest. Think of Sea-Tac as a landlord. The airlines and even the Centers for Disease Control are tenants. And you can't see it now, but that quarantine station you just saw on the South Satellite is about to get a lot bigger here.
The facility that we're building for the CDC is up to their latest standards. It's co-located with the Customs and Border Protection offices that are kind of behind that curtain.
Now, both the Centers for Disease Control as well as the U.S. Public Health Service are both under Health and Human Services, that part of the U.S. government, and they look at a lot of disease-related things here. So what are they going to look at now? Well, a lot like they did back in 2005. They're going to look for signs that somebody may be sick. They're going to be doing surveys saying, okay, where did you come from? How did you get here? If people show signs of illness, then they will deal with that. If they show, if they seem to be fine, but they come from a flagged area like parts of China, they're expected to receive educational materials which will say, if you feel these symptoms, then go see your doctor and then take it from there. So all of this has just really been announced. We had 5 airports before. Now we have really more than 20 involved here. And so this is expanding in terms of trying to keep this disease in check. Live at Sea-Tac, Glenn Farley, King 5 News.